Hi, my name's Erin and today I'm going to be talking about health and poverty. So health and poverty have always been linked. So the definition of poverty, there are two definitions of poverty. The first definition is absolute poverty. So absolute poverty is conditions where household income is insufficient to be able to afford basic necessities such as clothing, a home and food. This criteria will not change if the government becomes rich and wealthy. So if there's economic growth within a country that has absolute poverty, that poverty will not change. Differently, however, relative poverty is when a household receives 50% less income than the average median income. So this criteria will change if the government grows and there is economic growth within the country. So the link between health and poverty, as I said, there's always been a link between poverty and health, and it can be tracked back all the way to the 19th century. So in 1844, it was documented that unsanitary living conditions of people in urban areas was resulting in bad health. Edwin Chadwick pushed for the link to be acknowledged nationally, and he pushed for the Public Health Act. So in 1834, the New Poor Law Act was passed by Edwin. This meant that the poor were forced to work in workhouses as it was not deemed acceptable for them to be given handouts so that they could afford basic necessities. So instead, they decided to put the poor to work. So this meant that there was a rise in common diseases which eventually forced change within the government. So one of these common diseases was cholera. Cholera was seen to give people symptoms of violent sickness, diarrhoea, which then resulted in severe dehydration. So due to the living conditions and the workhouses that the poor were forced to work in, it meant that people were living in poor sanitation. So the liquid from the toilet was running down onto the street and into the main water supply for the town. This water supply would be used by everyone in the town for drinking water, cooking water and for bathing. So cholera was assumed to be airborne as it was only found in the poorer areas of the town. But John Snow argued this theory and that in fact cholera was airborne. In 1875, finally the Public Health Act was passed, forcing all local authorities to provide clean water and appointing medical officers in the town. So this seen a massive decrease in cholera as people had finally been able to access clean water. Another common disease that was found was smallpox. So smallpox came with the symptoms of a fever, vomiting, diarrhoea, severe headache, a skin rash, raised bumps that were filled with fluid, and eventually it would lead to death. So in 1834, the smallpox vaccination was available free of charge and administered by the Poor Law vaccination. So many people didn't get the vaccination and ignored the service that was provided by the government. So this led to the government in 1840 forcing the Vaccination Act. So this act meant that parents were obliged to get their child vaccinated within the first 3 months of their registered birth. If the parents didn't, then there was a high risk that the child would get smallpox, but still many parents didn't. So the government were faced with this battle against people, which led to the second largest smallpox epidemic, killing 44,000 people between the dates of 1870 to 1873. In 1871, however, the government made vaccinations compulsory. So this meant that all parents had to get their children vaccinated, otherwise they could be faced with a fine of 25 shillings and a prison sentence if still ignored. So this leads us on to micro and macro approaches to poverty. So agency and structure are the basic types of perspective sociology used in their work to determine if an individual acts freely. So micro poverty is due to a person's individual choices. So these choices could be bad or good. The model has been extended into a collective model. So culture is a way of life. Poor people, therefore, are learning to be poor and are causing poverty. So like how we discussed about smallpox, the poor were choosing not to get this vaccination. They were choosing these bad decisions, which could be argued it was just because that was their way of life. They weren't allowed to get vaccinations before they were free, so that was their life to them, so why would they change? Where macro poverty is caused by structural factors and situational constraints. So this can be linked to the concept of social class. So people have a lack of access to money and resources, so therefore they will be more likely to be in poverty and therefore likely to be ill of health. So if we look at micro and macro and how it can be applied to health in more detail, the micro level of health refers to interactions of a person. So it looks closely at sites of interaction. So this could be between a person and a healthcare professional, for example. So they look at these sites of interaction specifically. So it could be a person going to a doctor's surgery and having an appointment with a doctor, and they would then analyse the meanings behind any feelings generated from that appointment. It can commonly be associated with social psychology, whereas macro is far beyond sites of interaction. So macro looks at the area of study known as social distribution of health chances. So the researchers look at factors such as a person's gender and a person's ethnicity. And this, as well as material and cultural determinants. So this can then help establish how long a person will live and their morbidity rates. So if they're going to experience any illnesses throughout their life. So this leads to health inequalities. So the fundamental causes of health inequalities are the unequal distributions of the income, of the power, of the wealth. So this can lead to poverty and ill treatment of groups of individuals. So this structure of the world can lead to this unequal distribution of all the income and then can lead to poverty. So this then has a wider impact. So the unequal distribution of income, power and wealth has a wider impact on environmental factors. So this affects people's work, people's education, good quality houses, which then has a knock-on effect to the access of services and social and cultural opportunities in an area and in society. So this, as well as wider environmental factors, shapes an individual's experiences. So it sees low income in areas, poor housing, discrimination, lower accesses to health services. So the environment shapes an individual's experience across the population and leads to inequalities in health outcomes. So the distribution of income, power and wealth has a much wider impact than just the single person. So this is where political views come into play. William Beveridge, 1879 to 1963, was a liberal economist. So he was commissioned during World War II to help plan a future after the war. So he published his report, which identified 5 giants that were preventing Britain from becoming a modern society. So these 5 giants were want, ignorance, disease, squalor, and idleness. So if we look at these more carefully, so want, in 1946, Beveridge introduced the National Insurance Act. So this was implemented, giving benefits to unemployed people, to pregnant women, to pensioners. It gave sickness allowance, and importantly, gave benefits to widowers of women who had lost their husbands after the war. So this abolished the want, the need for money that wasn't easily solved. The only way to solve the want for money was to work, which in some people's cases was just not possible. So the National Insurance Act abolished that want. It gave people the funds they needed to live, even just a simplistic life, but meant that they weren't in poverty. So then, to abolish ignorance, we brought in the Education Act in 1944. So this implemented free education for all primary and secondary children up to the age of 16. So this got rid of the ignorance that nobody was educated, that nobody knew anything that was going to help them further their life and their career. So then idleness came into play. So idleness in 1948 seen the Employment and Training Act. So this established skilled workforces. So funding for school leavers. So we had all these kids at 16 coming out of a good education, and they were getting trained on the job, paid to train, and were getting skills that they wouldn't have been taught if they'd have gone into work at the age of maybe 7 or 8. So we're seeing servicemen being trained fully. We were reigniting areas of previous high unemployment, getting people back into work. And then the biggest one, possibly of all, disease. So in 1946, we seen the establishment of the National Health Service Act, which is still going today. So this seen free healthcare for all, including dental care, opticians, and prescriptions. So we've moved from people not being able to afford healthcare, people having lack of services, to this massive free healthcare, free dental care, free prescriptions, a massive push. So by 1949, 8.5 million people received free dental care. 5.75 million pairs of glasses were issued, and 187 million prescriptions. So we were getting a educated, trained, skilled workforce that were healthy and had a good healthcare system that was supporting them. So then just the last giant to fight, which was squalor. So in 1946 to 1949, the Housing Act was established, which gave money to local councils to rebuild, to refurbish homes after the war. So we were left with this destroyed society, lack of housing, destroyed areas, and we were rebuilding. We were getting people back into houses, getting people into work, training people, educating our society, giving free healthcare, getting everybody back to full health. And in 1946, 14 new towns opened. We were making new places, a new start. And by 1949, people had access to the countryside. The Countryside Act was passed. So we were getting people out of the cities into the countryside to get all the fresh air that they deserved. So this then seen the New Right. So the New Right came into play in the 1970s and seen the end to this consensus as Margaret Thatcher came into power. So the New Right seen the merging of the neoconservatives and the neoliberal beliefs. So the neoconservatives believed that you cannot achieve anything unless it is through the people, whereas the neoliberals believed that the government cannot engineer economic growth. So instead, they can create the conditions in which economic growth can happen. So they can set up the conditions, but it's up to the people to then get us to that growth. So the New Right seen the change in Britain and reshape in Britain's society. So the number of people working in manufacturing jobs and industry massively reduced, and people vastly expanded their ownership in capital. So we were seeing factories shut down, we were seeing people getting better education and training for jobs that were well skilled above working in a factory. So this seen people moving from lower class into middle class, and they didn't want to socialise. They were scared that the government would buy back what they allowed them to buy, which was their own council houses. They were scared that the government was going to eventually buy that back, and that it would mean that they would lose their capital. So this led to an expanding middle class, which were unsociable, they were hostile to society and social democracy. So the neoliberal and neoconservative policies. So there was this massive shift from wanting to help society, to enable society to grow, to giving society all of these tools and leaving it up to them if they wanted their society to grow. Then here was the tools, but they needed to do it by themselves. So the neoliberals, they supported individual freedom, there's support for market mechanisms and the private sector. So the NHS was being privatised, the Royal Mail was being privatised off. The support for economic inequalities combined with equality opportunities. They were against the post-war consensus, so all this that Beveridge had built, that he's given to the people, that they were thriving off, they were against that. There was support for privatising of the wealth system, the support for private healthcare and education, support for lower levels of government spending and lower taxation. So all the people who were thriving, who were doing good, who were living off of the welfare system as they didn't have a chance to work due to maybe a loss during the war, through a workplace injury, all of their benefits were being taken away from them. The healthcare system was being privatised, education was being privatised, lack of services were then reappearing in areas, and people were slipping back. So we've gone from this massive push, the government helping everybody, to this new government that were all for the middle class and the upper class, which was ever expanding. So the neoconservatives, again, their support was for the state, the support for traditional approach to mortality, support for traditional family, support for traditional education, support for national culture rather than multicultural. So everybody who come over after the war, who'd we'd invited to help rebuild Britain, to help rebuild all these new towns, the 14 new towns, were being pushed out. We didn't want them anymore. We wanted to take back Britain for what it was. But what we've seen was a slipping back to the poor health, the lack of services. So, To conclude, for the years it's been shown that many social factors affect people's health. So the main ones, education. The education needs to be there. We need to educate our society so they can then go on and train to work in good jobs which will give them good income, good living conditions, good work opportunities and financially be stable so that healthcare and services are accessible to them. If we don't have this good education, then they won't have the good living conditions, they won't have the work opportunities and they won't have the finance needed to have a healthy, happy life and have the necessity in life to carry on, which we have seen through time leads to illness and disease. So thanks for listening to my presentation.